Are you flossing your teeth wrong? So many of us have actually never learned the proper way to floss, so let's talk. Hi, my name is Whitney and I'm a dental hygienist here to talk about flossing. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can also help you stay in routine and use proper techniques for brushing and flossing. And having said that, for today's video, let's talk about flossing. I'll show you first how to floss on a fake mouth so you can really see what the motions should look like. And then I'll show you in my own mouth so you can really see the practicality of it all. So, start by getting a long piece of floss. A short strand is very difficult to work with. The longer the floss, the easier it is to wrap around your middle fingers. Wrap it around your middle fingers, leaving some space in between. Leave about 2-ish inches between the two wrapped middle fingers. Now, what you use to actually floss is both your thumb and index finger. The thumb and index finger work together to give you that strong manual dexterity in which you will feel control over your movements. First, make sure your floss, wrapped around your middle fingers, with your thumb and index finger holding the floss, is acting as your guides. Now, you bring the tightened floss in between your teeth by pressing and wrapping around a tooth. Make sure you're not popping straight down into your papilla. You want to wrap around the tooth, hugging the side surface of the tooth to the left and then to the right, scraping the sides of the teeth up and down, which is called the cleaning motion. You do not want to use the sawing motion to clean. The sawing motion will hurt your gums. The sawing motion is only when you're entering between the teeth, right? It's always followed by the cleaning motion, which is the up and down movement. Be sure to hug the tooth and go up and down on each side, making sure to go, yes, below the gum line, to the right and then to the left of the little triangle area of the gums called the papilla. The dental floss should actually disappear in the space between the gums and the tooth surface, the sides of the triangle. Now that you know the basics, I will show you how I floss my own teeth, a real mouth, so you can really see what's going on. So I have my floss, and now, just like with the demo video, I wrap the floss around one tooth at a time, really hugging the sides of the teeth, up and down to the left, and then up and down to the right. And then I move to a clean strand of floss and do the same thing throughout my entire mouth. And don't forget about the farthest back tooth. Even though there is no tooth behind it, be sure to still run the floss back there. And a helpful tip for reaching the floss far back in your mouth is to actually close your mouth a bit, so your cheeks are more elastic and you can really pull them aside to access the molars that are far back there. By the way, make sure you always wash your hands before flossing because you know you're sticking your fingers in your mouth. Make sure they are clean. I'm wearing gloves because I didn't want you to see my hands because I don't have a manicure, but you don't have to wear gloves, just wash your hands. So that is how I properly floss with traditional string floss. And if you're still having a hard time with the traditional string, then be sure to try floss picks or interdental brushes or a water flosser. Lots of different options to clean between your teeth. I will link those videos of mine below if you want to learn more. You just want to make sure you're cleaning between your teeth with something, right? Because when you're only brushing, you're only cleaning about 60% of your tooth surfaces, meaning you're missing the other 40%. So with flossing or any of those other cleaning between your teeth methods, you can effectively clean the other 40% of your tooth surfaces, thus doing 100% everything you can to prevent cavities and gum disease. And speaking of cavities and gum disease, if you're interested in creating the most perfect routine to prevent these major dental issues that lead to costly dental visits, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide and join thousands who have already discovered all of the essentials for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. And I hope this video helped you. Please like, subscribe, turn on your notifications if it did, and if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.